Hi everyone, I'm Jessica. What's your name?
Joey.
And this is Joey. And we are going to talk to you a little bit about Joey's cancer journey. So he just turned 3 at the end of last month. And in October 2018, when he was just 18 months old, he was diagnosed with acute lymphoblastic leukemia. And he has been fighting that ever since. It's so crazy because you don't think anything like this can happen to you. And I never thought I'd be a cancer mom, and then one day I was. And it all kind of happened within a few week time period. He started being really lethargic, and we noticed a lot of bruising. And then actually the day that I contacted his doctor to talk about, why he was acting this way, we started noticing a rash going up the back of his legs, and it was like these little red pin dots. And come to find out, it was a petechiae rash, which is a sign of leukemia. So his doctor sent us to Akron Children's Urgent Care, where the doctor looked at him for like a minute and then immediately sent us to the emergency room. We went there, they started taking blood work, and when the blood work results started coming in, they told us they were going to send us by ambulance to Akron Children's Main. His blood work was really off. His white blood cells were really elevated. His platelets were really low, and his hemoglobin was really low. So at that time, they didn't really tell us what was going on or what they thought. But when you hear white blood cells, your mind goes to cancer. And so I asked the emergency room doctor to come back in, and I said, well, what were his white blood cells? And he told me, and he said, if you want me to be honest, we're worried he has leukemia. And that was kind of the start of it. We found out that night preliminarily that he had leukemia. We got the official diagnosis 2 days later when he his bone marrow biopsy results came back. And then that was when he was officially diagnosed with the B-cell acute lymphoblastic leukemia. And I have to really give Joey some credit here. He's amazing. He shows us what it means to be strong every single day. Many days he doesn't get to have a normal childhood. Are you strong? You strong? But, like many days he doesn't get to have a normal childhood. He's sick, he's at home, he's isolated a lot of the time. But then there's many days that you wouldn't even know he had cancer, other than his cute little bald head when it was bald. But with that being said, we've had many, many bad days and a whole lot of ups and downs. We've had scares of relapse. I've had to sit there rubbing his back as he throws up, knowing there's nothing I can do to take the pain away. I've had to hold him down as they access his port, as he's screaming, begging us to let him go. And I don't tell you these things to feel sorry for Joey or for our family. It's just the realities of childhood cancer and the craziness and the hard times that these kids go through. So I'm just going to talk a little bit about his treatment now. So overall, the treatment's about 2.5 years long. Leukemia is really sneaky, so it can hide in places in your body. So even if they don't see signs of leukemia, they still treat for an extended period of time, just to make sure that all the leukemia is gone. His treatments consisted of 6 phases, and he's in the final and longest phase of maintenance now. The first phase, induction, is where they hope to, it's like a blast of chemo, and they hope to, they hope that the cancer's gone at the end of it. Unfortunately, his wasn't at the end of that first month, so he was bumped into what's called a very high-risk treatment. And so his treatment was even more intense than if he was just like a moderate-risk, normal kid who got leukemia. So as I said, we're in the final and longest phase. It's about 1.5 years of maintenance, so we have less than a year to go. He'll be done March 8th, 2021, huh?
I want to take a picture.
Yeah? Okay, hold on.